good. That's pretty awesome. Up and then down, yeah.
ZOLGENSMA is a prescription gene therapy used to treat children less than 2 years old with spinal muscular atrophy, SMA. ZOLGENSMA is given as a one-time infusion into the vein. ZOLGENSMA was not evaluated in patients with advanced SMA. ZOLGENSMA can increase liver enzyme levels and cause acute serious liver injury or acute liver failure, which could result in death. Please continue watching for additional important safety information.
My name is CG. My daughter Maisie was diagnosed with SMA at 6 months old. Maisie had started another treatment prior to ZOLGENSMA. At 20 months old, she received ZOLGENSMA. There's so many things you take for granted. Maisie can talk. Maisie can sit up. She can roll over. She can scoot. Maisie can crawl. Maisie can eat. She can snack. She can drive a power chair. She can use a wheelchair. She can put her shoes on. She can take steps in her parallel bars. She can walk in her gait trainer. She can brush her own hair. She can brush her teeth. She can scream. She can cry. She can argue. She can read. She can do homework. She can type. She can ride a tricycle. She can swim. She can dance. She can sing. She comforts the dog. Maisie gives the best hugs in the world. When she hugs you, she squeezes you. There's not a better hug. She can say, I love you. I love you. When I received the news that Maisie had SMA, the doctor put her hand on my hand and I knew something was very wrong. I knew as a mother the reason I wanted ZOLGENSMA was the one-time therapy. ZOLGENSMA stated halts the progression of the disease. And that's what I wanted to do for her.
Patients will receive an oral corticosteroid and will need blood tests before and after infusion with ZOLGENSMA.
All the stress, all the relief, or all the stress washed away. It was truly one of the happiest days of my life. There hasn't been a time yet that Maisie hasn't continued to improve. Maisie's superpower is perseverance. That girl never gives up. She never doubts herself. And she's always willing to try. When she stood and she would let go of the bars and she was just standing there and she was wobbling, her proud moments, being able to experience proud moments with her. The fact that she throws a fit because there's no more cake. I love the fact that she gets to do that. When she's getting a shot, she fights back and she's able to fight back. And then being able to see that she can do that now. All those things are just miracles and amazing. It's the littlest milestones that mean the most. Her being able to push a button to do independent things like keyboards, laptops, being able to hold a toothbrush so she can brush her teeth, being able to hold a cup and bring it to her mouth to take a drink, being able to use a fork, being able to talk.
I want to make cookies.
It's those little things, those like being able to argue with me. You take so much for granted, but it's the littlest milestones, the littlest things that really make my entire world with her. She goes in her little gait trainer, and she can actually propel herself now in her gait trainer. We celebrate dosing day. Celebrate it like a birthday. She gets gifts, she gets cake, she goes to Disney, whatever she wants to do. Now she gets like 2 birthdays a year. She's like, it's the day I got my medicine. People don't understand how weak she was, and how weak she still is, but how much growth she's had.
Ask your child's doctor about the one-time infusion with ZOLGENSMA. Please continue watching for indication and important safety information. Indication. What is ZOLGENSMA? ZOLGENSMA is a prescription gene therapy used to treat children less than 2 years old with spinal muscular atrophy, SMA. ZOLGENSMA is given as a one-time infusion into a vein. ZOLGENSMA was not evaluated in patients with advanced SMA. Important safety information. What is the most important information I should know about ZOLGENSMA? ZOLGENSMA can increase liver enzyme levels and cause acute serious liver injury or acute liver failure, which could result in death. Patients will receive an oral corticosteroid before and after infusion with ZOLGENSMA and will undergo regular blood tests to monitor liver function. Contact the patient's doctor immediately if the patient's skin and/or whites of the eyes appear yellowish, if the patient misses a dose of corticosteroid or vomits it up, or if the patient experiences a decrease in alertness. What should I watch for before, during, and after infusion with ZOLGENSMA? Infections before or after ZOLGENSMA infusion can lead to more serious complications. Caregivers and close contacts with the patient should follow infection prevention procedures. Contact the patient's doctor immediately if the patient experiences any signs of a possible infection, such as coughing, wheezing, sneezing, runny nose, sore throat, or fever. Decreased platelet counts could occur following infusion with ZOLGENSMA. Seek immediate medical attention if the patient experiences unexpected bleeding or bruising. Thrombotic microangiopathy, TMA, has been reported to generally occur within the first 2 weeks after ZOLGENSMA infusion. Seek immediate medical attention if the patient experiences any signs or symptoms of TMA, such as unexpected bruising or bleeding, seizures, or decreased urine output. There is a theoretical risk of tumor development with gene therapies such as ZOLGENSMA. Contact the patient's doctor and Novartis Gene Therapies, Inc. at 1-833-828-3947 if a tumor develops. Infusion-related reactions may occur during and after ZOLGENSMA infusion. Seek immediate medical evaluation if signs and symptoms of infusion-related reaction occur, which may include rash, hives, vomiting, shortness of breath, respiratory symptoms, and/or changes in heart rate and blood pressure. What do I need to know about vaccinations and ZOLGENSMA? Talk with the patient's doctor to decide if adjustments to the vaccination schedule are needed to accommodate treatment with a corticosteroid. Protection against influenza and respiratory syncytial virus, RSV, is recommended, and vaccination status should be up to date prior to ZOLGENSMA administration. Please consult the patient's doctor. Do I need to take precautions with the patient's bodily waste? Temporarily, small amounts of ZOLGENSMA may be found in the patient's stool. Use good hand hygiene when coming into direct contact with patient body waste for 1 month after infusion with ZOLGENSMA. Disposable diapers should be sealed in disposable trash bags and thrown out with regular trash. What are the possible or likely side effects of ZOLGENSMA? The most common side effects that occurred in patients treated with ZOLGENSMA were elevated liver enzymes and vomiting. The safety information provided here is not comprehensive. Talk to the patient's doctor about any side effects that bother the patient or that don't go away. You are encouraged to report suspected side effects by contacting the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch or Novartis Gene Therapies, Inc. at 1-833-828-3947. Please see the full prescribing information.